Are you currently suffering from pain on the top part of your shoulder and had a recent fall or trauma to that area? If so, there's a good chance you're dealing with something called AC joint separation. For those who don't know me, my name is Dr. Zach Good here at Performance Sport and Spine in Seattle, Washington. In today's video, we're going to break down everything you need to know about this condition, from the symptoms and causes to management and treatment, and how to make sure that you're dealing with this and not some other shoulder condition. Let's start with the basics. So the AC joint is right here in your shoulder, and it's what connects your collarbone or your clavicle to your shoulder blade or your scapula at the acromion. So it kind of looks like this. And there's several ligaments that stabilize it both on the edge and below. And these ones below are called the coinoid and trapezoid ligaments. And those will be important later as we classify what grade you have. And this joint is really important because it's one of the only bone joints in your whole shoulder. Everything in the back is muscle, so this is really important, but also pretty fragile if it gets direct trauma or strain to those ligaments. This AC joint condition makes about 10% of all shoulder complaints. And it's most common in 20 to 30-year-old males, and over half the people that have this will suffer from some sports injury. Unlike other conditions that can cause shoulder pain, an AC joint separation is almost always a result of trauma or falling. And this is specifically to the top part of the outside shoulder or secondary to a push injury, which means that when you fall and you outstretch your arm and when your hand hits, that force goes up and causes separation of your shoulder joint. So in this condition, there should always be a history or a prior episode of falling or severe trauma. Okay, let's talk about how this is going to present or what it's going to feel like. So the first thing is you're going to have sharp localized pain to that AC joint, and there's probably some difficulty raising your arm up. Secondly, the more severe it is, you get the step-off defect where the bone breaks enough that one actually pops up. So you actually might feel like the bone is protruding up through your skin or offset. One thing to note is we're going to go over the diagnosis later, and it's really important that if you have this condition that you seek out medical care and get an x-ray to quantify what grade and the severity of the condition. The next thing is you might have some swelling or bruising. You see difficulty raising your arm, especially forward. And there's tenderness. If you push on it, it's going to be quite painful. So you don't want to do that, but that's a way to know if it's there. Because it's the result of an injury, there's going to be a calming down period. So type 1 to type 2, you're probably going to need to rest a few days, maybe up to a week. Type 3 can be longer. Sometimes with type 3, you want to wear a sling to, again, let the inflammation calm down before you start the range of motion exercises. Once you feel like the pain level is adequate and you've assessed the degree, you've gone to a healthcare provider and you've had that x-ray, we want to start with range of motion, isometrics, and then normal rehab exercises. The best way to probably start range of motion is passive. So with a dowel or broom handle, if this is our affected shoulder, with our elbow straight, we're going to gently hold on to the dowel, press up as far as you feel comfortable, return to the starting position, and repeat. And the goal is to get to 180 degrees of overhead motion. Now this may take a while, so don't force it, but if you start to grimace or you feel tightness, stop and make sure your shoulder is relaxed and use your other hand to move it. Now the next one's going to be external rotation. So we're going to press our hand outwards, keeping our elbow pinned to our side. Now with this, the goal is probably around 90, but some people may have to stop earlier. You got to be careful as this is going to put more stress on the AC joint than the other ones. So just again, go gradually and as your symptoms allow, and don't force it. Now for internal rotation, we're going to use our hand, grab the dowel, and we're going to pull this way. We're actually going to pull our arm across our body. Make sure to keep that elbow pinned to your side and go as only that your symptoms allow. Don't pull too hard, and make sure that you don't feel too much stress on that AC joint. Another option is a wall slide or table slide. So you can put your hand of the affected shoulder on a table or a bench, and you're going to press our hand out lightly as far as you can, bending our torso towards the floor. Stop, return to the starting position, and go a little farther. And again, your goal is to try to get 180 degrees. Now that may be a little bit hard, but this helps you lightly, and again, you're gently just resting your hand. You're not pushing down hard, but you're trying to slide as far as you can, and then bend your torso forward. The next one is laterally or out to the side. So with that bench more perpendicular to, we're going to press our hand out, bend towards the floor of the bench as far as you can, return to the starting position, and if you need to make it a little more challenging, push it farther away so you can drip your shoulder all the way down and get that 180 degrees, and then come back. Only progress these isometrics if you can do the full range of motion in all the planes we talked about, You have very minimal pain, less than 2 out of 10. It does not persist, and you feel safe moving your shoulder in all directions. With isometrics, the means can be a force, but the joint's not moving and the arm's not moving, which is safer initially. So the first one is shoulder flexion or raising your arm up. But again, we're not actually going to move our arm. So we're going to keep our elbow straight, raise our arm to about 30 degrees, and then our other hand's going to resist it, and we're going to push up into that hand and hold for 30 seconds. Some mild discomfort is okay, but it should not hurt. Work up to holding for 30 seconds. The next one's going to be external rotation. So again, with our elbow to our side, hold our hand with the other hand, and we're going to push outwards for 30 seconds. Now, some mild discomfort, but it should not be painful. The last one's going to be internal rotation. So putting our hand inside our arm, we're going to press into that hand and hold. Keep our elbow pinned and feel tension on the back of our shoulder. To progress these level 2 exercises, you should be able to hold all 3 of those exercises for 30 seconds. Only mild pain, less than 2 out of 10, that does not linger and feels safe to perform those exercises. The banded lateral raise. So we're going to stand on the same side of the affected shoulder. So in this instance, it's the right shoulder. If you don't have a PT band, there's a link in the video to get one, but any PT band will work. With our elbow straight, we're going to raise our arm up to about 90 degrees, pause, and then return to the starting position. Slow and controlled, and really try to work on that back of that shoulder, doing the energy and the exercise, and go slow, no jerking. Over time, as you get stronger, you can raise the band up higher. Banded lateral raise. So with the band anchored about shoulder height, again, our affected shoulder is the right side. Elbow straight, pull your arm across as far as you can, pause, and then return to the starting position. With this, it's really important that you go slow and controlled, and there's no jerky. That's going to overstress that AC joint. As you get stronger and feel more comfortable, try to pull it farther and farther across your chest or midline. Banded pull down. So if you're doing it against the door, kneel down, or if you have a cable machine, just make sure your arm is as high overhead as possible. With your elbow straight, we're going to pull down towards the floor, slow and controlled, and then return to the starting position. Make sure you feel tension on the back side of your shoulder. To increase the difficulty, we're going to bend our torso forward to get more shoulder flexion or range of motion. And in this new position, with your elbow straight, pull down towards the floor, pause, and then return to the starting position. With the AC joint, a really good rehab exercise is the bottoms up carry. So with the kettlebell or dumbbell, we're going to hold it into 99th position, feeling some stress on that AC joint and that shoulder. And in that position, we're going to walk slowly, which helps build strength in walking and load. And what I want you to do is actually turn around, because that rotation stress helps prepare you for rotation, and then walk back the other way. The single arm shrug with a light weight, and this one I want you to start light. This is not a heavy shrug initially. We're going to hold it in the affected shoulder, and we're going to shrug straight up, pause, and then return to the starting position. Make sure to go up as high as you possibly can and hold. That helps strengthen those 2 lower ligaments that we talked about earlier. As you get stronger, you can increase the weight, but again, start light and then progress as your symptoms allow. To rehab that joint for pressing motions, we're going to start with a knee push-up. If this is too challenging, you can start against the wall or reduce your range of motion. And then from there, we're going to go to toe push-up. Again, maybe reduce your range of motion and then get full range of motion to prepare that shoulder for life. With AC joint separations, there's different degrees of severity of this one. It's not one size fits all for this injury. So the most common way to do this is the Rockwood classification that stratifies us out from level 1, least, to level 6, most. Now, what research shows us is that only level 1 to level 3 can be treated with exercises. If it's more than level 3, 4 to 5, 6, you need surgery. So this video won't focus on that, but it will give you an idea of what it is. But again, it's really important that you always get an x-ray and seek medical care to get an accurate description of the severity of your condition. Type 1, there's a sprain of the AC ligaments, but the CC ligaments are intact and there's no displacement of the bones. Type 2, the AC ligaments are disrupted, there's a sprain of the CC ligaments, and there's the movement of the bone of less than 25%. Type 3, both ligaments are disrupted and the bone has moved 25 to 100%, so you might get a step-off defect with this. Diagnostic imaging, x-rays are the first line of choice with 3 views. The first is anterior posterior, so front to back. The second is a Velpo view, which is 45 degrees up towards the head. And the last is a Zanka view, which is 15 degrees towards the head. It's important to note that these should be compared to the non-affected shoulder to look for differences. MRI is the best choice to assess or delineate integrity of the ligaments. There are some orthopedic tests that can be helpful. With these tests, the more positive tests you have, the more confident you can be in your diagnosis, as clustering findings is always better than a single test. The Paxonose test, where you squeeze the AC joint, the O'Brien active compression test, and the crossbody adduction test, also known as the scarf test. Another test, the Hawkins-Kennedy, is powerful if it's negative to rule out this condition. Thank you for watching our video on AC joint separation. We hope it provided some clarity and gave you some ways to rehab this on your own. Again, you should always seek medical care for this condition prior to starting exercises. If you did find it beneficial, please like it and check out our other great videos online.